Right, now we're going to talk or basically build the spinal column, looking at the vertebra and then something that forms when two vertebrae are stacked on top of one another called the functional spinal unit, the FSU, or sometimes called the motion segment. And that is two adjacent vertebrae. Let me get this. So we have one vertebra, two vertebrae, so in this case T6 and T7 stacked on top of each other. There's the intervertebral disc in the center. And then once we have this functional spinal unit, we can also see our intervertebral foramen. And then the ligaments that connect them. So this is the smallest unit of the spine that allows motion, right? You need two vertebrae to allow very small motions. All right, here's a cross section of the functional motion segment or the spinal unit, the FSU, or sometimes called the motion segment. I tend to say motion segment, so I'll probably slip into that terminology. But here we see a body of a vertebral body, another vertebral body, the intervertebral disc. Here are the spinous processes and the intervertebral foramen. All right, so these have minimal movement between them, but the cumulative effect of all the vertebrae stacked on top of another gives us the full range of motion of our cervical, thoracic, and lumbar spine. So it allows us to flex or bend over to pick something up, do lateral bend to the right and the left, extend, rotate right, rotate left. Another thing I just want to point out is that in between your articular processes is a synovial joint. So here we have the inferior articular process of one vertebra with the superior articular process of another. This is the synovial joint in here, and it has cartilage which moves. So these joints allow motion and restrict motion, but it's also good to note that since they're synovial joints, if there's too much compression or too much tension, there are a lot of nerve endings within that joint space. So the articulations of the vertebral bodies, right? So that's between one body and another. You have this, it's a cartilaginous joint, and it's basically the disc in between that allows the motion. The disc resists compression during certain types of movements. The annulus fibrosus, which we'll see in a moment, goes under tension. It also allows torsional motion. It's believed that the intervertebral disc also provides shock absorption. So let's look at that disc. We have three features of the disc. Sometimes some books will only talk about two, but there are three. We have the nucleus pulposus, which is gel-like and about 90% water. The annulus fibrosus, which is kind of a ligamentous structure encasing the nucleus pulposus. The fibers, it's multiple fibers, and they change their orientation. So if there's a rupture of one layer of the fiber, the nucleus pulposus cannot just leak out of the annulus fibrosus. I mean, it can, but it's difficult. And then you have the cartilaginous end plates, and those are lining the vertebral body. So let's look over here. So we have the nucleus pulposus surrounded by the annulus fibrosus. And then if we look at the top and the bottom, we have these cartilaginous end plates. And you can see here the loading. If we have a compressive load, which occurs when we stand up straight, the nucleus pulposus will have push out onto the annulus fibrosus, and then you'll actually get a tensile load in the annulus fibrosus. One injury that could occur in the disc is a disc herniation, sometimes called herniated disc, sometimes called a slip disc, sometimes called a bulging disc, but it's basically when the nucleus pulposus on the inside of the annulus fibrosus, based on many factors, starts to migrate posterior, and usually it bulges posterior laterally. And you can see over time it pushes through the fibers of the annulus and pokes out into the vertebral foramen or impinges on the intervertebral foramen. Either way, it starts to push on either the spinal cord or the nerve roots, and that can cause some pain, radiating pain, tingling, numbness, or weakness, right? Because nerves create the input into the muscles to generate force production. All right, let's look at the posterior part of the vertebra, the vertebral arch. Remember, we have the vertebral bodies anterior and then the vertebral arch posterior. And these facet joints are sometimes called apophyseal joints. There's two per functional spinal unit or motion segment, right? There's one on the right and one on the left. They are gliding in their motion, right? They're two flat surfaces encased by joint capsule, and they can glide as we go through flexion extension, lateral bend, and axial rotation. And the angle of the joint, or the angle of the facets, the processes superior and inferior, dictate the motion that's available, and that depends on the spinal level. So let's look, we'll look at that in a moment. First, going from superior to inferior, we have the atlanto-occipital articulation. So that's the condyles of the occipital bone. We see them here. And they articulate with the superior articular facets of the atlas. So the atlas sits on the condyles of the occipital bone, right? Atlas holding up the world or your skull. And the primary motion is flexion extension. So it doesn't look like a hinge joint, but it definitely acts like a hinge joint because this is what allows us to nod yes. If we go down to the atlantoaxial articulation, this is a pivot point. So you can see the dens peeking up through the atlas. So we're looking at the atlas. We see, we're looking at the atlas from a superior view, and the axis is beneath it, and the dens of the axis protrudes up to kind of fill that space of the atlas where it has no vertebral body. It is a pivot joint, and this allows us to say no. So do axial rotation right and axial rotation to the left. Cervical facet joints. So now we're going to look at all our facet joints going down. You can see that they are angled about 45 degrees from vertical. It allows flexion extension of the cervical spine, lateral flexion, or I like to call it lateral bend, and some axial rotation. And then when we look at the entirety of the cervical spine here, we can see the nice angulation of these facet joints. So they're at about 45-degree angle. And again, there's gliding motion of those joints. At the thoracic level, the facet joints face more backwards, slightly upward, and lateral. So it's not at a 45-degree angle. They are facing mainly backwards and slightly lateral. So we get axial rotation, some flexion extension, and some lateral flexion. Remember, also on our thoracic region, we have the demifacets, so the ribs articulate here between two vertebrae, and they also hit the costal facet. And again, look at a full skeleton to really see what's going on with the ribs and the articulation with the thoracic spine. The lumbar facets, they actually face inward, so they're facing medially and slightly backward, and they allow flexion extension, lateral flexion, but very limited axial rotation.